Hello, come on in, take a seat. Tell me, what's bringing you in today? So you are here for your first annual exam and pap smear, and you kind of want to get an idea of what like a real-time experience is like. Absolutely. Well, let me walk you through what that process is going to be. So basically, you'll check in with me or in other offices that aren't ASMR related, the receptionist office. You're basically going to check in and then give me your first, last name, date of birth, just so we can confirm we have the right patient and right appointment. Okay. And then this is your first annual. Awesome. We will just want to confirm that the insurance on file that we have for you is correct. Awesome. And do you have a preferred pharmacy of where you would want us to send you prescriptions in the event that you needed a medication sent? Okay. And what city is that in? All right, excellent. And then do you have a preferred number for contact, whether it's your cell phone, your home phone? Okay, gotcha. Okay. And then what about an emergency contact? And you said that was mom's? Okay. Excellent. So then we are going to get you checked in here, and then the medical assistant, which happens to be me, is going to take your vital signs and just kind of collect your history, making sure we're all up to date and we do the necessary tests for you. So with that being said, I have a chart here set up for you. So you are 21, right? Okay, so yeah, this would be your first pap smear. Are you coming in with any other concerns at all? No? Do you need any routine STI blood work or any additional testing today outside of the pap smear, which is what screens primarily for cervical cancer? Nope, that's all you needed today. Okay, understood. And so what I'm going to do is I'm just going to get your vital signs first, and then I just have to collect a quick history on you just to put in the system so Leanna, the PA, is ready to go when she sees you. Exactly, yep. So give me 1 second. Let me grab my sanitizer. I think I left it in my other coat here. There we go. So we'll get my sanitizer on here. I am just going to get a blood pressure. Let's get this going. So if you wouldn't mind, you are actually just going to rest your feet on the floor. No history of high blood pressure in the past? Okay, just want to make sure. You wouldn't mind sliding your arm into there. There you go. Blood pressure is normal. Excellent. Let me take this off of you here. There you go. Blood pressure looks great. Do you know roughly how tall you are and what your weight is? Any updated weight that you've had recently? Okay. Let me just write all that down then. So height, I said 5'5". Weight you said was 157. abdomen, okay? All right, your blood pressure here. Lastly, I just need to get a temperature check from you, just with all viruses that's been going on around here. Yeah, annuals and paps honestly go by way faster than people think, so. This is just gonna go underneath your tongue. There you go. Just gonna wait a little bit. Awesome. All right, temperature is normal. Leave that over here for now. Pop some sanitizer. So, I just have a few questions that I have to put in the system. As far as medical history, anything medically we should be aware of, or are you on any meds right now? Okay. Any surgeries? No. Do you smoke or drink? Okay. Any family history of breast, ovarian, uterine, or colon cancer? What about cervical? And are you sexually active at this time? Male, female partners, or both? Okay, and any history of ever contracting any form of sexually transmitted infection? And do you know by chance if you've been vaccinated for the Gardasil? You have? Very good. This is going to be your first pap smear. And do you use any forms of birth control, whether hormonal or barrier methods like condoms? All right, perfect. I have all the information that I need. I set up Leanna, the PA's choice. Basically, the only things you're going to be seeing her use are gloves. She'll be doing a breast exam, an abdominal exam, and then for the pelvic exam, she'll of course look on the outside, and then you'll see a speculum. She usually starts with a thinner and smaller one first. Depending on your anatomy, if she has to change the size, she will let you know. And then you are going to see this container here with the two brushes here, and this is for a pap smear or the cervical cancer screening. It is not screened for anything else, okay? Awesome. And then the final thing is you'll see a little thing of lube, and that is basically for the manual exam where she just checks to make sure that she doesn't feel any masses or tenderness. Are there any portions of the examination that you're uncomfortable with, or everything seems pretty straightforward? Pretty straightforward. You've had a pelvic exam before? Oh yeah, then you honestly may not even notice a difference with the pap smears. I always have patients come in, concerned about us taking chunks or like something really scary, but it's literally just these two brushes. It'll probably feel weird if you do feel it, but I've had patients say they don't feel it at all. So I guess we'll see. Absolutely. Well, just know you are in great hands. Leanna, the PA, will be in to do the annual exam in real time. No lengthening, no extra ASMR, just so you can see how quick they really are. You are so very welcome. All right, enough talk for me. There's a blanket on the medical counter there for you. You'll keep your shirt on, take off your bra, and you'll get undressed waist down and just put a drape over you, okay? You're so very welcome. She'll be in. Hello. My name is Leanna, and I am the PA that will be doing your annual exam today. Do you have any questions before we get started as far as the components of the annual, or you feel like Lee, the MA, kind of went over everything? You're all set and ready to get this over with? I don't blame you. All right, well, then let's get going for you. So I am just gonna put some gloves on here, and we will be starting with a breast exam first, if that's okay with you. Awesome. All right, so I'm just gonna move this a little bit, just exposing just the side here. You're gonna feel my hands here. You let me know if you get uncomfortable, but you haven't noticed any lumps or anything concerning with the breast tissue, right? Good. And if you wouldn't mind just lifting this arm for me. No swollen lymph nodes, no nipple discharge or skin changes. Very good. I'll cover you up on that side. We'll make our way to the other. All right, I'm just going to expose this side a little bit. Same thing. Feeling any lumps or seeing skin changes? Can you lift this arm for me? And no swollen lymph nodes, so that's very good. And both breasts appear symmetrical. Okay, now I am just going to press on your belly here, making sure I don't feel any masses. You're not having any pain, right? Good. Excellent. Let me cover you up here. All right. Let's get this tray and everything prepped for you. And then I'm just going to move my chair up. All right, put one foot in each for me. There you go. There you go. And scoot a little bit more down. Perfect. All right. So we are going to start just from looking on the outside first, okay? So you'll feel my gloves here on the outside. Just making sure I don't see any suspicious moles or lesions. And nothing is super tender here, right? Good. Okay, I think we're ready now for the internal exam. We're just going to take our speculum, put some lubricant on there. Lubricant is kind of cold, so I apologize. All right, so you're going to feel some cold pressure here. Pressure, there you go. You let me know if you feel anything that's causing you pain. Then we're going to quickly open up this pap container here, and we're going to get the pap smear. I'm going to insert this. First brush is done. Second one. And that's done. Your pap smear is completed. It really is that quick. Yep. And then of course we'll want to take out the speculum here. Now that your pap is done, I'm going to take that out. Perfect. And the last part of the exam is just with my glove, where I look to see if I feel masses or that you're tender at all. All right, you're going to feel some pressure here. Feeling any enlargements or masses. All right, you are all done. Yes, that was all it was. Pap smears are actually a lot faster in person than online because we try to exaggerate the sounds a little bit. But really, that was it. You are completely done. And so thank you so much for coming in and for for helping us normalize getting your pap smear done with proper communication and education. I personally find, as someone that does a lot of individuals' first time paps, 9 times out of 10, probably 99% of the time, they end up going great as long as you have proper consent and the patient is properly educated on what's going to happen. Just always remember, you are in control of the examination, but you did absolutely fantastic on your annual this year, and you are going to be good to go till next year. Yes, and I will call you if there's any abnormal results. I will give you some privacy here to get dressed, and the girls will see you at checkout. See ya.